Up next is me, Cristal Salatas. Let's get started. Okay. I will be presenting things on preterm birth and nutrition and the effects that they have on each other. So what is preterm births? This is babies born before the 37 completed weeks of pregnancy. And from 2010 to 2020, there were 152 million preterm births worldwide. In 2020 alone, there were 13.4 million preterm births, of which 1 million of these resulted in deaths. The causes and risk factors of preterm births vary from individual to individual. So we wanted to know how something that is modifiable, such as nutrition, before and during pregnancy, can influence the risk of preterm births. So we analyzed data and meta-analysis to determine how micronutrient supplementation specifically, before and during pregnancy, can influence this risk. So we included trials that focused on either pregnant women or women planning on a pregnancy that gave them either micronutrient supplementation or a micronutrient prioritizing diet before and during pregnancy compared to either their usual care or a control. And we focused on either the gestational age or the preterm birth. Let's go on to results. So for preterm births, we found a statistically significant decrease in the risk of preterm birth by about 8%. This was based on high certainty of evidence, so it included several trials with a lot of people. For gestational age, we also found a significant increase in the gestational age by about 15 hours, a little bit over. This was based on low certainty of evidence with a lot of trials. This seemingly small increase in gestational age doesn't seem important, but it is, because a baby that is born at 22 weeks and 6 days has a higher chance of survival if we can keep it in the womb for that extra 15 hours. And this can be done with micronutrient supplementation, as we found. So the successful interventions are a series of single nutrients, which is what you would expect in terms of folic acid and omega-3, and then multiple micronutrients, which is a combination of a lot of these nutrients. Now I will present subgroup analyses, so I want you to follow along with me. So I did conduct further subgroup analysis to see how each of these individual topics influence the risk of preterm birth. We found statistical significance with the duration of the interventions. So interventions that lasted for less than 8 months were statistically significant in reducing the risk of preterm birth compared to greater than 8 months, as well as the timing of intervention. So when the intervention started, interventions that were started either in the first or the second trimester of pregnancy were more significant in reducing the risk of preterm birth compared to all other trimesters and even preconception. We found significant results, though not significant in the subgroup interaction for the risk. So the mothers who came into the study with a prior high risk of having a preterm birth did find statistical significance in reducing this risk if they were supplemented with micronutrients, as well as the 2 micronutrients that we found to be significant, fish oil and calcium. So what does this all mean? We found that healthy supplementation of micronutrients before and during pregnancy compared to anything else is successful at reducing the risk of preterm birth when you are supplementing either a single or multiple micronutrients such as fish oil, calcium, or any combination. Supplementation begins either in the first or the second trimester. Supplementation lasts for less than 8 months in duration. And you are supplementing women who are at prior high risk of having a preterm birth. We did have several strengths to our study, so we included a very large and diverse population from 52 different countries. But we also had limitations. So if you notice in the giant table before this one, there were only 1 study that contributed to the less than 1 month in duration. And also the dosages for the different types of micronutrients ranged throughout the study. So there was not one consistent dosages that I can tell you now is the best to supplement women with. So to conclude, implementing a single micronutrient or multiple micronutrient to a pregnant woman's diet, particularly when it is fish oil, calcium, for less than 8 months, and in the first or second trimester to prior high-risk women, has a significant interaction with reducing the risk of preterm birth, though we do recommend further investigations to be able to reach the gaps that we found. And when we want to compare this to just diet and supplementation, supplementation is more significant in reducing the risk of preterm birth compared to diet alone, which was very interesting when we compared the 2 studies. And that is it. Thank you.